Well, hello, everyone. Thank you for joining us. We just came from an excellent announcement on the Blood Reserve for opening up a brand new recovery community we're very excited about. And I'm equally excited to be here with Minister of Hospital and Surgical Health Services, Matt Jones, Minister of Jobs, Economy, Trade and Immigration, and MLA for Cardston, Siksika, Joseph Schow, Parliamentary Secretary for Rural Health South, Justin Wright, and of course, Cardston Mayor Paula Brown to share great news about the future of healthcare in Southern Alberta and specifically the future of the Cardston Health Centre, which has been serving residents of Cardston, members of the Blood Tribe, and folks in surrounding communities since 1959. Much has changed over the decades, including the number of Albertans who now call Alberta home. Since 1959, Alberta's population has increased from just over 1.2 million to more than 5 million people, with nearly 600,000 new residents in the last 5 years alone. Our population is also aging. In less than 10 years, more than 1 million Albertans will be seniors. It's a perfect storm that creates real pressure on our healthcare system and especially on a 67-year-old health centre. That's why Alberta's government is investing $74 million over the next 3 years to replace the Cardston Health Centre with a new modern facility. This funding will support planning, design, and site readiness for the replacement health centre that will provide better access to care for people in Southern Alberta. It's an investment in what really matters to Albertans, quality healthcare that meets their needs when and where they need it. I know this is an important project for Southern Alberta, and especially for residents of Cardston and area, members of the Blood Tribe, and the Hutterite, Latter-day Saints, and Mennonite communities. The new facility will improve access to integrated, high-quality healthcare that reflects the needs of a growing, aging, and increasingly diverse community. It will bring innovative technologies, increase capacity, and deliver a range of essential health services without requiring patients to make the long drive to Lethbridge or Calgary. Today's announcement is another step in our ongoing work to refocus and strengthen Alberta's healthcare system. And it builds on our other investments here in Cardston and across Southern Alberta. For example, Budget 2026 invests more than $908,000 over 3 years for capital and maintenance and renewal at health facilities in Cardston and Vulcan. This funding will ensure hospitals and health centres remain safe, reliable, and able to continue delivering care close to home. In the broader Southern Alberta region, we're investing $59 million over 3 years in the Chinook Hospital in Lethbridge and the Medicine Hat Regional Hospital to expand cardiac services and intensive care capacity, which means patients can access specialized care closer to home. We're also investing $39 million in the University of Lethbridge Rural Medical School, creating more opportunities to train doctors in smaller communities and keep them there. The bottom line is simple: investing in the health of Albertans is non-negotiable. No matter where you live, you deserve access to the care you need when you need it, close to home. That's a top priority for our government, and we'll continue investing in projects like this one because it matters, not just to Albertans today, but to the generations to come who will depend on a strong and responsive healthcare system well into the future. I'll now turn it over to Minister Matt Jones to share more details.
Thank you, Premier, and good afternoon, everyone. It's a pleasure to be here today to join you for such an incredible announcement for Cardston and really Southern Alberta. As Alberta grows and ages, we are seeing more complex health needs across the province. That growth requires a health system that is not only responsive, but built for the future, one that serves both urban and rural communities effectively. In rural Alberta, that means ensuring people can access care closer to home without having to travel long distances to receive urgent or acute care. They deserve modern facilities that reflect how modern health care is delivered and how it will be delivered in the future. The current facility, which we're in today, has served this region well for decades. It was built in 1959, expanded in the early 80s, but is now one of the oldest health facilities in the province. And it serves more than 16,000 residents in the Cardston-Kainai region and supports about 500,000 visitors to the Waterton National Park. So I'm pleased to be here today to announce our government's commitment and really the beginning of the new Cardston Health Centre. Alberta's government is committing $74 million over the next 3 years towards the overall $474 million development to modernize and build a new facility. This project started with a needs assessment back in 2021, which was followed by the completion of business case and site selection in 2022. And it is now advancing through planning and functional programming. We're targeting early works to begin in summer of 2027 and hoping completion can be done by early 2031, subject to, of course, approval and planning milestones. The new facility will integrate acute care, diagnostic imaging, allied health, public health, mental health and addiction services, home care, and even other services under one roof, improving care coordination and expanding regional capacity. It will increase the inpatient capacity from 19 to 24 beds, including labor and delivery, postpartum isolation bariatric rooms, along with 11 emergency treatment spaces. Furthermore, the center will reflect the unique needs of the various communities it serves, with the Blood Tribe invited to collaborate in the functional programming process of the health center development. This investment represents a major step forward for healthcare in Southern Alberta and will ensure patients can access the right care in the right place at the right time. I'd like to thank all the healthcare workers, volunteers, and community members who have supported patient care at this facility for many years. And I'd also like to highlight, in particular, the advocacy and efforts of my friend, the local MLA for Cardston, Siksika, and now Minister of Jobs, Economy and Trade and Immigration, Joseph Schow. I can recall, long before I was the Minister of Hospital and Surgical Health Services, his advocacy back starting in 2019 for this project. And he didn't stop for years, and multiple health ministries. He made the case for the new Cardston Health Center. And so it's an incredible testament to his dedication and representation and advocacy. And with that, I'd like to thank Minister Schow for his advocacy and also turn the podium over to him for him to provide his remarks. Thank you.
That's high praise, Minister Jones. Thank you very much. That means the world to me. And of course, thank you, Premier Smith, for being here today for this incredible announcement. And all those who have also been mentioned. You cannot see them on camera, but we also have a number of representatives from the healthcare community and also from Cardston County. I know Reeve Randy Bullock is here, as well as other councillors from the town and the county. And I want to thank them as well for their advocacy. Mayor Brown, you have been a stalwart in this project since you and I first met years ago, and your predecessor as well, Maggie Cronin. There are so many people who have helped make this day a reality, and I have to give them so much gratitude and thanks. And I'd love to go on, but there are too many people, but I'll suffice to say this: you know who you are, you know what you've done to get us at this point, and I am grateful from the bottom of my heart, and the town will remember that. I've been the MLA for Cardston for nearly 7 years now, a job that has been the greatest honor of my life and position I take incredibly seriously. I chose to put my name on a ballot in Cardston because I'm a proud fifth-generation Albertan, parents and grandparents and great-grandparents who have called Cardston and the surrounding area home. This is a story familiar to many Albertans, particularly in rural communities, as they build a sense of connection to the communities they grew up in and eventually want to raise their own families here as well. Rural Alberta offers something special. It offers a great place to raise a family, start a small business, retire, and grow old. But for this to remain a vital place, remain that special place, it is vital that we have services like healthcare, avoiding long trips to the city for basic services. Although a small town, Cardston Health Facility serves a large population. And that facility, the one we stand in today, has become one of the oldest healthcare facilities in the province, no longer meeting the community needs and soon reaching the end of its own life. For nearly 7 decades, the Cardston Health Centre has delivered life-saving care thanks to the remarkable work of healthcare workers like those who join us today. But the time has come for its replacement, and I and many other leaders and community members have spoken that we could not be more excited about this day for this to be happening. For people who call Cardston and this area home, providing health services in the community means not just having to drive 80 kilometers in Lethbridge, particularly in times of emergency. The time it takes to travel from here to there could possibly mean the difference between life and death. Firsthand, our community has seen examples of this. Because we have a health center with incredible nurses and doctors and other healthcare workers, there are people, even friends of my own, who would likely not be here today if they did not have access to this health facility and had to drive into Lethbridge. I will close with this. This government stands with rural Alberta, and this new health centre is an example of that. Rural Alberta drives economic prosperity and offers families something that cannot be found many other places. Investments like this are preserving that and ensuring communities like Cardston can remain strong for generations to come. Thank you. I'll now turn it over to the Parliamentary Secretary for Rural Health South, MLA Justin Wright, my good friend. Thank you for being here.
Well, thank you, Minister Schow, and thank you everyone for joining us here today. It's an absolute honor to be with you all as we speak directly to one of the most important issues facing rural Alberta, and that is access to reliable healthcare close to home. For people who live in rural communities, healthcare isn't just about convenience. It's about safety, certainty, and peace of mind. It's about knowing that when something happens, help is nearby, and that families don't have to travel hours to get the care they need. That's why we're making this announcement today, and why this announcement matters so much. It's been my absolute honor to join Minister Schow in advocating for this project, because it means better outcomes right here, locally in southwestern Alberta. This investment supports planning, design, and site readiness for a modern facility that reflects how healthcare is delivered today, and that rural communities will need in years ahead. This project is about ensuring the people of Cardston, Kainai region and visitors continue to access healthcare without having to leave the region. This replacement health center will integrate emergency and acute care with community programs, allied health, public health, mental health and addiction supports, and home care, creating a more coordinated and responsive model for the region. Importantly, this approach recognizes rural healthcare must work for the communities it serves. More than 16,000 residents rely on the services provided by this center, including a large portion of care delivered to members of the Blood Tribe, along with Hutterite, Latter-day Saint, and Mennonite communities. Designing a facility that reflects these realities and supports the culturally appropriate, accessible care is crucial. This investment is about protecting our rural capacity more broadly. By strengthening care close to home, we help reduce unnecessary travel, relieve pressure on our larger urban hospitals, and ensure rural emergency and acute services remain available when and where they're needed most. At its core, this announcement sends a clear message: rural Albertans matter, and access to health care should never depend on where you live. Thank you, and with that, I'll turn it over to Mayor Brown.
Welcome to the town of Cardston. We would like to welcome the Premier Danielle Smith, as well as MLA Joseph Schow and Minister Jones and Wright. I would particularly like to take a minute and let Minister Schow thank him for his tireless work that he has made to put this new hospital a reality. Without his advocacy, we would not be here today. So, thank you. This new facility will replace our existing hospital here in town, a place that has served this community well for many years. But like many rural facilities, it's reached a point where it can no longer meet the growing needs of our residents. This new hospital represents the next chapter. For our seniors, this means a higher standard of care and more confidence for families who want to know that their loved ones are being looked after right here in the community that they help build. For local residents, it strengthens the quality of life in a very real way. Access to reliable healthcare is one of the biggest factors in whether people choose to stay, raise families, and put down roots in a community. This hospital helps make that decision easier. And from a business perspective, the impact will be significant. Strong healthcare infrastructure attracts new investment, supports workforce growth, and gives employers confidence that their employees and their families are well cared for. It sends a clear message that this region is open for growth and we're ready for it. Projects like this don't just meet today's needs. They position us for tomorrow. They create jobs, drive economy actively, and help ensure that communities like ours continue to thrive. So again, thank you to the Government of Alberta for recognizing the importance of rural healthcare and for making this investment in Cardston and surrounding area. This is a big step forward, and it is one that will make a lasting difference for many generations to come. Thank you.
Thank you to all of our speakers. We'll head into our media Q&A portion now. We'll be taking one question, one follow-up, and we'll start off with questions here in the room before making our way to the phones. And a reminder just to state your name and outlet before asking your question. And we'll go to our first at the mic.
Justin Sibbett with Global News. Premier, do you want to maybe talk about the two announcements today and just kind of the excitement in seeing that Cardston and area is getting a huge boost in healthcare?
Well, it's really amazing. So let me start with the first, because they can be connected. One of the things that we do find is that many of our hospitals have been supporting those with mental health and addiction needs. And so by having this companion announcement today on the blood reserve, where we have a 75-bed facility, 60% for men, 40% for women, but also being able to give Western as well as Indigenous healing practices to help those who are suffering from the disease of addiction. We think that that's going to not only allow people when they leave a hospital environment to get back into the community, but to do so in a way that is going to be supported. And so that's one big announcement we did today. And then on top of that, Cardston is a clear hub for the region. And we want to, and it was one of our aspirations from the beginning, and also under our Minister of Hospital and Surgical Services, is to make sure that people have the critical health care that they need close to home. They can't have every medical service available in the community. There's some things you just have to go to a big center like Calgary and Edmonton for, or a larger regional hospital like Lethbridge. But we want to aspire to have as many services as close to home as possible. And to do that, you need a facility that's not at end of life. 67 years is pretty old for a health facility. It's served the community well, but to make the investment so it can serve it well into the future is what's in mind today. So we're very pleased with the advocacy of Minister Schow. I can tell you, he sits next to me in the legislature. I hear about it a lot. And so I don't know what he's going to be lobbying me on next, but he's relentless. And I'm glad that we were able to get both of these announced today.
Mayor Brown, as well for you, just to know that your community is receiving this kind of a boost. What does that mean for you and the community of Cardston?
So for the town of Cardston, Kainai, and the county, it is fantastic. It is about helping those right here in the community that they help build. Their taxpayer money went into this area, and now whether we're delivering babies here, and by we, clearly it's not me, but whether we're delivering babies here, helping people through crises, whatever that is in their life, or helping our seniors, I mean, that's what it's about. Cardston we're hoping that Cardston it's a place of families. Family is important for us. And whatever that family looks like, we know that a hospital helps heal it and helps bridge the gaps. Thank you.
Go to our next at the mic.
Carson Marsuk with CTV News Lethbridge. Question for the Premier. A request to increase the number of Alberta seats to 91 was only one suggestion from one member of the Electoral Boundaries Commission. Why only accept that one recommendation and not the majority of the report?
Well, I think we have to realize that this report really was three reports. There was a majority report, a minority report, and a judge's addendum trying to bridge the gap between the two. And when you look through the report, there are many references to the lament that the majority of members had about losing two rural ridings. And, being here today shows you exactly why. When you represent a rural riding, as I do, and I'm sure that Minister Schow could talk about it as well, like I represent a riding that has a mid-sized community, Medicine Hat, a large community, Brooks. It's got County Annual, which is a rural community. It's got Bassano, it's got Dutchess, it's got Rosemary, it's got Hamlets, and I've got 3 school boards. There's a complexity when you're dealing in a rural community that is very, very different than if you're in simply a big city like Calgary and Edmonton. So that's what the lament was about, is does a community get so big in size that you end up compromising effective representation? And what I gathered from the judge and from the views of many of the majority of the committee, they didn't want to lose rural communities. But the problem was we've grown 20%. The seat increase was only 2%. And I think the judge came up with a reasonable solution that we can make sure that we are appropriately representing our large cities without losing rural by just adding 2 seats. And so that's the reason why I think, because that was reinforced multiple times as the members of the Legislative Assembly contemplated that, as those of us in rural Alberta contemplated the complexity of dealing with much and ever larger constituencies, I think effective representation won out, and that's why we put forward the motion that we did.
And just to follow up, what do you think of the Commission's minority report?
The minority report was rejected. We have accepted the majority report with the addendum of the judge, and you'll see that in his recommendation 5, he is quite prescriptive about the areas that he thinks were problematic. And so we'll put that to a committee led by Brandon Lunty, and then my understanding is that will then go on to another review panel. They'll look at all of the information and all of the submissions from everybody, and then they'll find a way to add back those 2 additional ridings and then make some of the adjusting changes that will take place. But it's all under the guidance of what was written in the addendum. Thank you. Yeah.
Thank you. I don't see any other questions in the room here, so we'll head over to the phones. Operator, could you put through our first caller, please?
First question comes from Zoe Mason of the Medicine Hat News. Your line is already open.
Great, thank you. I think my first question is for Minister Jones. You outlined some of the expanded features this new facility in Cardston is going to have, including additional inpatient beds and emergency treatment beds. I'm curious what the anticipated expected workforce demand to serve this new facility will be. How many new staff will you need?
Thank you. So that's certainly part of our planning when we build a new facility or enhance an existing facility. This facility is actually already operating at 24 beds, although it's funded for 19. But rest assured that we're going to make sure that the facility is adequately staffed to provide the care that the new and modern facility is capable of providing. I'd also point out that with modern facilities, you can actually provide care more easily from a staffing standpoint because it's built for modern technology, it's built for modern care practice. And in fact, we're going around the province right now assessing all of our rural facilities for their overall condition, but also their functional condition from a workforce perspective to learn exactly that, to inform investments in workforce that are necessary to support those facilities and new ones like this one.
And do you have a follow-up, Zoe?
Great, thank you. Yes, thanks. My second question is for the Premier. Following up on my colleague's question there about the Electoral Boundaries Commission, yesterday I spoke to Opposition Leader Naheed Nenshi, and him and the NDP are describing this move as your government's attempt to rig the election. Why should Albertans see it any differently?
Well, he's not telling the truth. He keeps trying to imply that we're accepting the minority report. We're not. We've rejected the minority report. We've accepted the majority report with the addendum from the judge to try to bridge the gap between the two. And the way he proposed bridging the gap was to add 2 additional seats. And you'll see even in the recommendations of the majority report, that was one of the things that they requested the latitude to do in future. And the fact that they put that in there suggests to me if they had had the latitude to do that in this iteration, they would have done it. So we're, I think, keeping with the spirit of what was represented again and again in the report, lamenting that they were going to end up reducing rural representation. We have to be very mindful of what effective representation means. I described that a little bit earlier, but the whole concept of a riding comes from how long it would take you to ride a horse across a territory. That was the whole notion of it, that if you get too geographically big, it becomes very difficult to give effective representation. Of course, we've got modern tools, but if you understand just how difficult it is to try to represent some of these very geographically diverse ridings with multiple different municipalities and school boards, I think the issue of effective representation was one, mindfully, that the judge was right to flag, and his solution, I think, is an elegant one. And so the That's what was persuaded the majority of the members of the Legislative Assembly. So Brandon Lunty, the private member, is going to be leading the MLA committee that looks at how we can do an accelerated review to implement the judge's addendum.
Thanks, Zoe. Operator, could you put through our next caller, please?
The next question comes from Janet French of CBC Edmonton. Your line is already open.
Hi there. Question for Minister Jones. Some hospitalists and orthopedic surgeons are facing internal disciplinary procedures, having their privileges revoked, and AHS and Covenant are filing complaints to the College of Physicians and Surgeons after they diverted patients for safe care or they didn't work shifts because their contracts ended. So I understand your office says that you don't direct these kinds of steps, but do you condone this, and why?
So there's well-established processes for providing reasonable notice when seeking to change or withdraw privileges or services. And when those steps are not taken, of course, the service provider, AHS or Covenant in this case, will escalate through the medical bylaws or CPSA. And that's what's occurring here. I'm pleased to share that services is continuing. There's been very minimal disruptions. We had two surgeries postponed. For perspective, we do 6,000 per week. And I'm also pleased to share that we are hiring additional hospitalists because, again, the compensation we're offering, which is roughly a $450,000 salary, with after-hours modifiers up to $183 extra per hour for evenings and weekends coverage, is really top in the country. And again, we've been seeing a tremendous interest in actually our postings for additional hospitalists in the Edmonton area.
So some people might describe this approach, though, as punitive, right? Going after their professional status of some of these doctors during a contract dispute. How is this meant to improve recruitment and retention of family doctors and specialists in the province?
Actually, the focus is on ensuring care for patients. And as you can appreciate, if a medical professional or the site administration did not show up, that might impact patient care. So there's accountabilities on both sides to ensure that we all do what we need to do to provide the care that patients need and expect, and that there is reasonable notice, there's transition agreements, and then ultimately that the important work that needs to be done in our hospitals is done. The vast majority of the time, this is done very well in collaboration between medical professionals and site administration. In some small cases, some steps are missed, and in those cases, we go through the medical bylaw process or escalate through the CPSA.
Thank you, Janet. Operator, could you put through our next caller, please?
Your next question comes from Will Bassett of Western Standard. Your line is already open.
Hi, thanks for taking my question. My question is for the Premier. Premier, the NDP and the leaders say it'd be one thing if a trustworthy government was taking the measures that you guys are taking with the electoral boundaries report, but he doesn't necessarily believe that what you guys say, that the new recommendations are going to come forward based on the majority's report. So my question would be, why should Albertans trust and believe that these new boundaries will be based on the majority's report?
Because that was what the recommendation was that was passed in the legislature last week. The majority report with the addendum and direction from the judge. The judge was pretty clear about which areas he felt that the majority got right, but he was also very clear about the need to add 2 additional seats in order to address the issue of rural representation. And so that was a persuasive argument. He's given some guidance, which was also passed in the legislature, about how to look at restoring that rural representation. And that will go forward to the MLA committee, which will then go forward to another independent commission who will look at all of the submissions. And we would hope with the clear direction of the judge in the addendum, as well as the direction of the legislature, that they will follow that.
Thank you. And then my follow-up is for Minister Schow. Minister, your riding would appear to be one of those most affected by the majority report and the changes, kind of taking away the more northern effect and bridging it with the Tabor-Warner riding. And so my question would be, can you speak a little bit to some of those changes and how you think that's going to meet the needs and affect those within your riding?
Well, thank you for the question. I would say I'm going to let the process play out. I made my own submissions about what I think is important for rural representation, and I believe that was reflected in the report. And today's announcement is a perfect example of what happens when you have rural representation advocating for rural needs. I can't say enough about my colleague, Minister Jones, and how receptive he was to hearing the concerns that I have and other colleagues have about rural healthcare, and how receptive he was despite being from Calgary. A lot of gratitude goes to him as well as to the Premier for her leadership and understanding that no matter where you live in this province, you deserve equal representation, but you also deserve equal access to critical services like healthcare. So that's why I'm grateful for this announcement today, because it's proof that our government is committed to healthcare in this province and making sure that we also support rural Alberta. I put my name on a ballot to make sure rural Alberta was not forgotten. Today is proof of that.
Thank you. We have time for one or two more questions. Operator, could you put through our next caller, please?
Your next question comes from Jack Farrell of the Canadian Press. Your line is already open.
Awesome. For the Premier, also on the boundaries report, you said here today that you rejected the minority reports, and you pointed to some concerns Justice Miller had about it. I was wondering if you had your own concerns about what the UCP appointees put forward and kind of why you think they might have put forward what they did and kind of led us into this kind of unprecedented process that we're now in.
Well, I think you have to remember that we started this commission process some time ago, and I think we're all fully grappling with the fact that we've had 600,000 newcomers come to our province in the space of 5 years, and I think it's been 800,000 since the previous election. And so I think that because that was a constantly moving target as they were going through this process, I think that the report itself, the judge himself, identified how difficult it was to try to manage only a 2-seat increase when you've had that kind of change in the population. So the problem, of course, when you have an independent boundary commission is you've got to leave them to do their work. We didn't foresee that they would come back and say we could have done it better if we had given us 91 seats. That's what the judge believed was the way to get rural effective representation. I voted in favor of the motion, so I agree. And the MLAs in the legislature also voted in favor of that motion. So we're looking forward to seeing how the new commission that's appointed by the independent committee will take the addendum and adjust the majority report's maps to make that work.
And then as a quick follow-up, I didn't know the vote took place, but my actual follow-up question is,
it did take place.
Doug Ford has kind of taken some heat today for buying a private jet for the travel that he does. I'm just wondering what you think of that expense, and if you've considered buying a jet for yourselves and your staff for the travel that you guys routinely do.
Well, I'm not from Ontario, so I trust that the Ontario government is able to do their own assessment on the business case for that. So I would leave it to them. We've not done an assessment on the business case, but I can tell you that I travel commercial or in a vehicle when I'm traveling around the province. And that has been a decision that we've had since, I can't remember, like 2020. I think that's been the case since about 2015 or so.
Thank you. We have time for one last.
And I should just clarify, sorry, my House leader has told me that we didn't, we've just introduced it into the legislature. So you'll have to see how the vote goes on the motion when it comes forward. When is it coming forward, Minister? It's coming forward on Tuesday.
Perfect. Thank you. We have time for one last question. Operator, could you put through the next caller, please?
The next question comes from Darren Rathwell of 660 News. Your line is already open.
Hi, thanks for taking my call. According to the Canadian Press, Elections Alberta says the decision to revisit how provincial ridings are drawn up will be a challenge. And it needs at least 1.5 years to iron out all the details for new ridings, leaving them about a year to prepare and should lead to increased costs for the process. Are there concerns about that being taken into account?
Well, I can tell you that there is also an independent committee that looks at the Elections Alberta budget. The office has made requests before to increase the budget for additional pressures that they've had, and Elections Alberta will get all the resources that they need to make sure that they can run a full and fair general election.
All right, thank you.
Yeah.
Thank you. Thank you, and that's all our time for questions today.
Thanks, everyone.